I think what's been very interesting in the past is that we've typically looked at Waldenström's as a spectrum, but we've looked at it very clinically. We've looked at it from patients that just have a monoclonal protein in their blood, to people that do have Waldenström's but it doesn't need treatment, to people that then are symptomatic and need therapy. This work really looked at a multi-omics approach, which looked at both the genetics and then the transcriptomics and then the phenotype of the cells as measured by cytoff, and showed that we can actually see 3 different molecular appearing groups that we can see within the spectrum of everything from a monoclonal gammopathy through to a symptomatic patient. And I think what that tells us is just that the way in which you get to these clinical symptom clusters, if you like, is actually molecularly and sort of immunologically driven. And we really can see 2 main kind of themes coming out. One is there's a real push in the microenvironment of the tumor for high cytokines and very inflamed and activated. And on the other side, we can also then see a more proliferative, where the tumor is really kind of looking like it's growing almost more independent of the microenvironment. So we're thinking that what's happening is, in the beginning, you have a very inflamed environment in the bone marrow, and all the cytokines make the tumor grow. And in time, the tumor becomes more and more autonomous, doesn't care about that, and grows all by itself.